Welcome back. Well, some of us associate the warmer weather with outdoor activities like gardening and strolling through the park, but others associate the higher temperatures with staying cool indoors. However, many of us don't know that both could result in exposure to a common type of bacteria that can cause a serious and chronic condition called NTM that can lead to lung damage. My guests are Dr. Patrick Flume. He's a pulmonologist and professor of medicine and pediatrics at the Medical University of South Carolina. And Debbie is an NTM lung disease patient. Thank you both for joining me.
Thank you.
Thank you.
Dr. Flume, what is NTM lung disease and why is it important for people to know about it?
So NTM, as you said, non-tuberculous mycobacteria, these are common bacteria that are in the environment, they're in the soil, they're in the water supply. We're all being exposed to it, but some people are developing infection as a result of that. And if they develop chronic persistent infection, it can result in NTM lung disease, which is a chronic, progressive, and often severe loss of lung function. And why it's important is because the symptoms that one gets associated with NTM lung disease are pretty nonspecific, and they mimic other conditions that may lead to a delay in the time in which diagnosis is made.
Well, what are the symptoms and who's most at risk for NTM lung disease?
So the symptoms of NTM lung disease can be respiratory. They can be a cough, not usually a new cough, but a persistent cough. That cough can be productive of sputum or phlegm. And there are other nonspecific symptoms like night sweats, low-grade fevers, overwhelming fatigue, chronic weight loss. So it's kind of like having the flu all the time. The people who are most vulnerable to developing infections are those who have underlying chronic lung disease, like chronic obstructive pulmonary disease, or COPD, or emphysema, bronchiectasis, cystic fibrosis, or immune deficiencies.
Well, how are people exposed to NTM bacteria, and are there any ways to reduce exposure?
So yes, so all of us are being exposed to these bacteria because they are in the environment. They're in the soil, they're in the water supply. But there are some measures one might take to try to reduce their potential exposure. So for example, working with the soil, we're trying to reduce the development of dusty environments. So wetting the soil, or perhaps wearing a mask when gardening to try to prevent inhalation of these particles. And then these bacteria like water, and so avoidance of things like hot tubs or turning up the heat in your water heater might reduce the number of organisms that could be in the water supply. Or some have advised going to shower heads that reduce the mist, so larger bore shower heads, or frankly skipping showers and going to baths instead. And these are measures that some have recommended to try to reduce your exposure.
Well, how are people tested for NTM lung disease, and what can be done if someone tests positive?
So the first and most important step is to try to increase awareness to get your clinician to actually consider the diagnosis of NTM lung disease. And if one is suspicious, then imaging of the chest, usually with a CT scan of the chest, to look for typical features that would suggest NTM lung disease. But that's not diagnostic. That is merely adds to the story, and what you need is to identify and isolate the bug. And so we do that by culturing specimens from the airways, either by collecting sputum or by getting airway secretions by bronchoscopy. Now, if one grows NTM, that doesn't mean that they have to be treated with antibiotics. And so a careful assessment of the patient, treating the underlying lung condition might make a big difference. Prevention of complicating features like aspiration and esophageal reflux. And if one does need antibiotics, typically we're talking about multiple antibiotics over a long period of time. So there are guidelines that have been published to give guidance to clinicians to choose the right form of treatment for patients.
Well, Debbie, how long did it take you to get your NTM lung disease diagnosis?
Oh my goodness, it took 15 years. And during that time, I was misdiagnosed with borderline asthma, and possibly one doctor thought it was lung cancer. So I had an episode toward the end of that 15 years, which really brought this thing to light. And I had many of the symptoms that we were talking about before, a cough, which I've had for a long time cold, but that day I had chills, sweats, fever, and turned out I was diagnosed with pneumonia. My doctor saw an abnormal x-ray and he didn't understand it, so I was referred to a pulmonologist who finally sent my cultures out to a specialty center in the country, and that's how I got to the diagnosis. I was really grateful for the diagnosis, even though it's not a fun diagnosis to get, but at least I was able to get on a course of treatment, and I feel so much better since.
And has your lifestyle changed since your diagnosis?
Yes, it did. It did change. So one of the things we were thinking about doing, my husband and I, were retiring to Florida, but we were advised not to because of the humidity and the fact that, as Dr. Flume mentioned, there are these bugs in water. So we decided to go to the desert in California, which has worked out very well for us. Also, I love to hike, but can't do uphill hikes now because I become breathless, so I have to stay flat on flats and downhills. And if I do have to go uphill, well, because when you go downhill, you have to go up. So I have to take it slowly and carefully. I also try to take baths instead of showers, and that kind of prevents aerosolization of the NTM into my lungs. And when I do take showers, I wear a mask. I try to avoid indoor swimming pools and hot tubs. So, and then, in the course of a day, I have airway clearance treatments that I give myself, and that probably takes up an hour and a half of every day, an hour in the morning and a half hour in the evening. But it's all worth it because I can lead a better lifestyle now that I'm not feeling ill so much for 15 years.
Well, how do you reduce exposure to bacteria in your daily life?
It becomes part of the normal course of the day, and it's not as crazy as it sounds.
And Debbie, in your experience, why is it important to talk with a doctor if you think you have NTM lung disease?
It's really, really important to talk to the doctor because some people who let this go for a while wind up in a situation where they become very ill. So if anyone suspects that they have NTM lung disease, they need to, first of all, arm themselves with information, and you can get that at a great website, aboutntm.com, which has information about treatment and what to expect. It also has patient stories. So anyway, that's what I recommend.
What advice would you have for others about talking with their doctor about NTM?
Well, again, arm yourselves with information and make sure you have your questions written down. And make sure that you, in many cases, some of the doctors don't know about it, so it would be helpful to even bring in the information. There has been many times that I've seen doctors that knew little or nothing, so I brought brochures and other information. And it's interesting that many times patients have to educate their doctors. So that's very important, that not to ignore any of these symptoms and try to get to it as soon as possible.
And doctor, what resources are available for people who are interested in learning more about NTM lung disease?
There are several resources, and I would caution people about the internet in general because there's a lot of misinformation there. But as Debbie mentioned, a good place to start is aboutntm.com. We've only mentioned sort of tip of the iceberg, and that's a good place to get more information.
Thank you both for joining me.
Thank you.
Thank you.